and community outreach. This session will showcase how his mission is being extended by his own devotees and alumni and institutions to every corner of our country and indeed the world. We will also hear about the academic and systemic integrations that strengthen this mission, demonstrating the Sai healthcare is not static, but it is dynamic, ever evolving, ever collaborative, and ever compassionate. To open this session, we are honored to welcome Padma Shri Dr. V. Mohan, Trustee of Sri Sathya Sai Central Trust. Professionally, Dr. Mohan is the chairman of Dr. Mohan's Diabetes Specialty Center and the Madras Diabetes Research Foundation in Chennai. For his extensive contributions in the field of diabetology, he was awarded the Sri Sathya Sai Dhanvantari Seva Award by the Sri Sathya Sai Seva Organizations India in 2012. He was also conferred the prestigious Padma Shri by the Government of India. In addition to his academic and clinical excellence, Dr. Mohan provides lifelong treatment, free treatment to thousands of underprivileged patients through his pre-diabetic clinics and has conducted over 3,000 free diabetic camps, including several in collaboration with Sri Sathya Sai Seva Organization. Today, he will share his reflections on the topic, Prevention is Better Than Cure, with a special focus on diabetic care and control. Padma Shri Dr. V. Mohan.
I offer my most humble pronouns at the divine lotus feet of our Lord and Master, Bhagavan Sri Sathya Sai Baba. I would like to thank Dr. Sundaresh for the kind invitation. Whole morning I was sitting, listening to the fantastic presentations, and the more I hear about the work, how many over time I've been associated with the organization and trust now for over 30 years. But every time it's a revelation to hear how many lives are being touched. It's a very humbling experience every time I come to Puttaparthi. Therefore, this meeting, I think, is a meeting with a difference, and all of us will go back fully charged and inspired. I thought I'll talk about diabetes, because this is a condition. I don't want to embarrass you by asking how many of you are diabetic in the audience, but if my statistics are correct, quite a few hands will go up if I ask you to raise your hands, whoever has diabetes. So it's a very, very common condition. At age 50, if you live in a city like Chennai or Delhi, almost half of the population has diabetes, and about 1/4 has pre-diabetes. So by age 50, you live in Delhi, Chennai, Mumbai, one of the big cities, 75% of the population, I'm not talking about people coming to my hospital, the population has either diabetes or pre-diabetes. Only 25% are normal. So with that, you can expect that it will touch all our lives. And therefore, this is a disease which leads to a lot of cost, misery, unless it is well controlled. And therefore, I thought we'll talk a little bit about that. The mention was just made that yes, within Puttaparthi, we know that the Sai healthcare works very well. But we also heard presentations from Rajkot, Ahmedabad, and other places where the Sai mission is being carried out. But I'm sure you all know that in every state of this country, almost every city of this country, we have clinics which are offering free service following the same principles by the Sathya Sai organization. So these principles are universal. The decommercialization of healthcare, human values, preventive care, and adding the touch of spirituality, hearing from the morning, to do everything with love. I think these are universal. These are not confined just to our organization or even to India. I think it is global. And therefore, in every doctor, if you're part of the medical profession, I believe that in whichever specialty you do, you may not be able to do everything free of cost because there are costs involved in running institutions. But the principles should still be followed. If you're able to do part of what you do, following this principle, that itself will be a big step forward. So talking about diabetes in India, in 1972, when I started my work as an 18-year-old and joined my father and started working not only as a first-year medical student, but also started working in diabetes, the prevalence of diabetes is only 2% in the cities and 1% in rural areas. After 1991, after India opened up its borders and allowed foreign investment to come in, two things happened. One, of course, economic growth happened. And that's when India, from a very, very poor country, started becoming almost a developed country. Now, in the next 10, 15 years, will probably become a developed country. But with that, the price we pay is obesity and diabetes. And as you can see further down the graph, it's all gone. And the last study we did in two cities, Delhi and Chennai, shows almost 1/4 of the population having diabetes. You may think just now I told you 50%. This is about 20 years of age. And in the same study, when you look at 50 years of age, half the population has diabetes in Delhi and Chennai, and the same is true for Hyderabad and Mumbai. In the tier 2 cities, Coimbatore, for example, it will be slightly lower. And then the villages, it will be still lower. But you can see that the villages also, it's almost up to 20%. And when we did the next big study, the ICMR indirect study, which covered the whole country, state by state, representative sample of every state in this country, every union territory, every island has been covered in the study. About 124,000 people when we completed, and we've had 113, we're not finished Jammu and Kashmir, Andaman, Nicobar Islands. Now we finished everything. And the numbers that came out from this particular study are quite staggering. 101 million people today have diabetes in our country, and 136 million people have pre-diabetes in this country. Now, what does this mean in terms of this particular conference? It means that equitable health care must be given to all these 100 million people. Now, 100 million people, some of you may not know how big it is. It's almost twice the size of UK or 4 times the size of Australia. That's the number of people with diabetes in our country. And this is going up very, very rapidly. Next 5, 10 years, it'll become 130 million, 140 million. How are we going to give equitable care when half the people cannot even afford to buy their own food? They can't make both ends meet. That's where the challenge comes. And just private care alone is not going to do the job. Just government care alone is not going to do the job. I think everybody who is having anything to do with medicine has to reach out to the poor. We heard beautiful examples of that in the morning. And that's how we joined with the Sathya Sai organization to run free clinics, to run free mobile clinics, and so on and so forth. It's just one example of that. Some of my colleagues devote 1 day a week to doing free service, and the rest of the days they do their practice. Whatever you can do, but it has to be done. I think it's a national call that we cannot just live on people and get money from them. We have to give back to society. Now, in one of the interviews, Swami asked me suddenly, Doctor, what is the cause of the increase in diabetes in our country? I was a bit taken aback. I told him various things like, is it our genes? Is it this? Then he said, our genes were the same 30 years ago. So why is diabetes increasing? Then he told me something which I would never have imagined. He said, you have done the research, you have got the data, but you have not analyzed your own data. I am telling you the answer to your data. I'm telling you how. Go and look at your data. He said, white rice, the amount of rice that you consume is the reason why diabetes is increasing. From Puttaparthi itself, I rang my research colleagues and said, can you pull out all the data on diet that you've taken in our epidemiological studies? And true enough, what we found was that when the rice intake, now this is in Chennai, where everybody eats rice, but even that, if you divide it into 4 quartiles and look at the first quartile, about 200 grams of rice, and the 4th quartile, where 400 grams of rice, diabetes prevalence goes up 4 times. So suppose 8% have diabetes in the first quartile, it's 32%. So Swami knew all the answers, and he knew my own research, and I had not even analyzed it. That is Swami, and that is divinity. So I always say that Swami should have been the first author of this paper because the whole idea was his. But this is a cross-sectional study. Later we did a longitudinal study. And the longitudinal study, what they will do is they'll take people who did not have diabetes initially, take all their dietary history and then follow for the next 10, 15 years and see who develops diabetes and then try to link it to the rice intake. And to cut a long story short, in this paper we showed that there's a very strong correlation between white rice intake and nuances. Diabetes, exactly what Tommy had told me in the interview. So then we start, what about physical activity? Physical activity is also very important because if you don't do exercise, then you'll see that those who do heavy exercise at that time in 2005, 5% of people had diabetes, whereas those who don't do exercise, the light exercise, it goes up to 17%. So the two main things which applies to all of you sitting here, when you talk about people with diabetes, don't think of some patient who's coming to us. All of us are also prone to that. So two things are very important. Eating too much, especially carbohydrate, and not exercising. If you do these two and you correct these two, 50% of diabetes can either be prevented or if you've got diabetes, you can even reverse it. Now, for prevention of diabetes, what we mean is that I know there are things like stress and so on, which you can also reduce by doing meditation, yoga, and pranayama and so on. But you have to do physical activity every single day and also modify your diet. And I'll tell you what that diet is. That means you can push diabetes and you're getting it at 40 years, you get it at 70 years, then only after 100 years of age, you will get complications. But if you get it at 30 or 40, by the time you're 50 or 60, you may have kidney disease, heart trouble, and all the other complications, which are very, very costly. Treating diabetes is not costly. Treating its complications is very costly. So how to prevent diabetes and chronic diseases? The first thing is to have a proper diet. So you should eat well, eat slowly, eat on time, eat right, and have a complete balanced nutrition. The plate concept, which many of you would have already heard of, is very, very important. Just now when you went for lunch, what you would have done is you would have put first rice on your plate, then some sambar, then some rice, and then you would have had rasam. Then you would have put rice, and then you would have had some curd with it. And then probably end with a dessert or something that also has carbohydrate in it. So that's why we become a carb-rich nation, and that's what is driving the diabetes, as Swami had taught us. The way we eat is when you have a plate, half of that plate you fill with vegetables, green leafy vegetables of different colors, which are very low in calorie, full of nutrition, and it doesn't increase your sugar at all. 1/4 of that plate you keep for protein. Vegetable protein is the best. Try to avoid animal protein. If you're still taking non-veg, try to switch over and become a vegetarian. Vegetable protein in the form of Bengal gram, green gram, black grams, chana, and paneer, milk. All these are very rich sources of protein. Protein helps to reduce your sugar levels and gives you muscle mass as well. And then the last portion alone, you can have your chapati or your rice. So when you cut down the carbohydrate, you will be able to either prevent diabetes, reverse diabetes, or at least control your diabetes well. And of course, you can use the same principles are enunciated here in just of time. Now, we did this. You may ask, how do you know all this? Everything is backed by science. In the same INDIAB study, we went back and using mathematical calculations, we tried to see how much of carbohydrate has to be reduced, because there are people who take keto diet and go completely off carbs and have zero carb diet. But if you do that, you start taking 80% fat, which is also not good. You go and block your coronary arteries. So all you have to do is only 10 to 15%. So this is what we published, showing that about 10 to 15% if you reduce carbohydrate. That means in the plate concept, when you reduce your carbohydrate, automatically that happens. And what do you replace it? With protein. So if you're able to take pulses, legumes, beans, these kind of things and fill up and replace that carbohydrate, we have shown that you can actually prevent diabetes. Exercise is very important because it helps not only control the sugar, but also cholesterol, increase the good cholesterol or the HDL cholesterol, decrease your triglycerides, and has many other benefits. But I have coined what is called as the PAR principle. Everybody knows about going for a walk. But remember, there are 3 components to exercise which we should all do. First is flexibility. So being able to turn, touch your toes, And that kind of flexibility you should do every single day, 7 days a week. Aerobic exercise, you can do 5 to 6 times a week. That's where you're walking, jogging, swimming, playing badminton, or anything that helps where you move from one place to the other. And the third is resistance training, which everybody above 40, 50 should do, because Indians do not have enough muscle. And to build that muscle, you have to do light weights. And if you do those light weights, you will find that your muscle mass is good. You will not fall. You will not, slip and fall and have a head injury or break your hip and so on. So building muscle is also very important. That's where the protein also comes in. Swami has said that the secret of perfect health lies in keeping the mind always cheerful, never worried, never hurried, never borne on by any fear, thought, or anxiety. And this is where spirituality comes in. And that is where we all have to practice little bit of mindfulness, little bit of spirituality. Whether you have diabetes, don't have diabetes, it doesn't matter. This should become part and parcel of our sadhana. 3 things you have to achieve, the A, B, C. If you want to prevent complications, you may have diabetes, it doesn't matter. But if you keep the A, B, C under control, your A1C below 7%, blood pressure less than 140/90, and cholesterol and LDL, with a little bit of diet and exercise, which I told you, then you can prevent complications of diabetes. You may ask, do you have the proof for that? Yes, indeed, we have the proof for that, because here is a paper which we published some years ago. In fact, it was the first paper in the world to show 50-year survival of people with type 2 diabetes. So we were able to show that if you control the blood pressure, HbA1c, and lipids, you can have 50-year survival after getting type 2 diabetes. So if you get it at 30 or 40, at the age of 90 or 100, you could still be alive. When my father's days, somebody crossing 60 years of diabetes is considered almost an impossibility. But today, I think you can live up to 95, 100 years of age. You may say, do you have the proof for that? Yes, indeed, we have. Here is a paper we published on people above 90 years of age. You may not believe this until you see this picture. Now, everyone in this room is above 95 years of age. I hope you can spot the 2 people there who are below 95 years of age. And one that's me and my daughter next to me. Some of them went on to cross 100, 103 years of age, finished 60, 70 years of diabetes with no complications at all. Yeah. And all that is really is the ABC. So if you keep your sugar, blood pressure, and cholesterol under control, you can have a long and healthy life despite diabetes. The mantras are eat less, walk more, get enough sleep, and reduce stress. Swami said, engage yourself in service activity, consider social service a service to God. This is the best way to earn God's love. Love all and serve all. Your entire life will be sanctified thereby. Whether you're a doctor, not a doctor, any other health professional, not a health professional, I think we can do seva, because I think Swami has said, love all and serve all. And with that, I'd like to thank you. Please,